Welcome to Section 3 of Public Health Sciences. In this video, we'll discuss the concept of capacity. Let's get started. In this section, we'll be discussing issues surrounding capacity, including advanced directives and surrogate decision-making. First, some terminology. As I mentioned in previous lectures, capacity is a medical determination made by a doctor about whether a patient can provide informed consent regarding a treatment or procedure. Competence is a legal determination made by a judge that refers to a more global lack of decision-making ability with regards to one's own medical care. Remember that determining capacity does not require a consult by a specialist, but can be made by the primary care provider. It's also important to know that decisions that a patient has made previously when he or she had decision-making capacity cannot be simply revoked if the patient loses capacity later. The patient's autonomy must be respected by honoring his or her previously stated wishes. Determining capacity is a qualitative and subjective judgment made by the physician. However, the following concepts are useful to keep in mind. Are the patient's decisions consistent with their goals and values? Are they informed and mentally with it? Has the patient expressed a clear preference? Is there any interference by altered mental status or mood disorder? Does the patient's decision remain stable over time? And finally, the patient cannot be a minor for most things. However, there are exceptions, as we discussed in the last lecture. After considering these factors, the physician can make a subjective judgment call on whether a patient meets criteria for decision-making capacity. All right, now let's discuss advanced directives. An advanced directive is a previously stated wish that comes into effect if someone loses the capacity to make a decision for themselves. There are several different classifications of advanced directives. An oral advanced directive is the weakest type and is often open to interpretation. Questions can arise about whether the patient was properly informed or if those who heard the patient express his or her wishes are remembering correctly. This type of advanced directive still carries some weight, but is not ideal. A written advanced directive is much more authoritative and specifies specific healthcare interventions that the patient would accept or reject during treatment of a critical or life-threatening illness. A living will is an example of this. Medical power of attorney is a legal designation whereby a patient identifies someone to become a surrogate decision-maker if they are incapacitated. This can also be invoked by a patient with capacity to make decisions. Finally, a do not resuscitate or do not intubate order, or DNR/DNI, is another specific type of advanced directive that prohibits CPR and intubation if a patient is determined to need it. These interventions would otherwise be initiated in emergency situations if DNR/DNI was not specifically requested. All right, last but not least, let's go over surrogate decision-making. If the patient doesn't have a clear advanced directive, it's important that a surrogate decision-maker be identified. The order of designating a surrogate without prior identification is first spouse, then adult children, then parents, siblings, and finally other relatives. If none of the above can be found, the physician can make decisions for the patient based on what he or she thinks is in the patient's best interest. So it's important to remember that the patient's best interest must be the primary consideration in decision-making by the surrogate decision-maker. All right, now that we've covered the information, let's review with a couple of practice questions. A 91-year-old male presents to the emergency department with severe altered mental status after being found by his neighbor on the floor. He has no clear evidence of injury, but he is somnolent and confused on physical exam. Laboratory testing reveals that he is septic. Antibiotic therapy is initiated, but the patient continues to deteriorate and will require intubation and admission to the ICU. The neighbor isn't aware that the patient has any serious chronic health problems, but states that he thinks he remembers the patient telling him that he wouldn't want a tube down his throat and would rather die peacefully at home. You have no contact information for any of the patient's family members. What is the best course of action? A. Intubate the patient and transfer to the ICU for further treatment. B. Withhold intubation and hope that antibiotics alone will be enough. C. Stop all treatment and send the patient home. Or D. Convene a hospital ethics committee to determine the best course of action. Okay, this patient obviously does not have decision-making capacity. The question in this situation is whether the stated oral advance directive of his neighbor is sufficient grounds upon which to withhold treatment. While this is a subjective judgment, often test questions will require you to make these sort of judgment calls. In this particular instance, the neighbor is not completely sure of the patient's wishes. From the question, it says he thinks he remembers the patient telling him. With this uncertainty in mind, we can deduce that he is not a good candidate for surrogate decision-making. In this emergent situation, and in the absence of additional information of family members, the best option is A, to intubate the patient and transfer to the ICU for further treatment. B, and C are both incorrect because the neighbor's advance directive is not reliable enough to be used as justification for withholding any life-saving treatment, whether that be intubation or antibiotic treatment. D is incorrect because convening a hospital ethics committee would take too long, and you should be able to make the decision on your own. So again, the correct answer is A. Intubate the patient and transfer to the ICU for further treatment. Keep in mind that consulting a hospital ethics committee is almost never the correct answer, because the whole point of the question is to get you to exercise your ethical judgment. So be wary of selecting this as an answer. Okay, let's move on to the next question. A 65-year-old man is hospitalized following a construction accident that involved several broken bones that were repaired surgically. He is recovering well until post-op day 2, when he suddenly has profound chest pain and difficulty breathing. He also has altered mental status. After a few minutes, he stops breathing, and you cannot find a pulse. You decide to initiate CPR before finding that he has a DNR/DNI order in his chart, which was updated at the time of admission. His wife is at the bedside and states that though he may have expressed a DNR/DNI order, he didn't really mean it because he thought that he wouldn't need it until he was much older. She pleads with you to do everything you can to save her husband. What is the best course of action? A. Start aggressive resuscitation measures to attempt to save the patient's life. B. Consult other family members to get a better sense of the patient's wishes. C. Do not resuscitate the patient in accordance with the DNR/DNI. Or D. Convene a hospital ethics committee to determine the best course of action. So this is a pretty tough case. Unfortunately for the patient's wife, a clear and current DNR/DNI order cannot be overruled by her objections. The most ethical standard for making these decisions is to ask the question, what would the patient choose if he were able to decide for himself? In this case, the patient has a clearly expressed and current DNR/DNI status, and it is not for the doctor or family member to determine whether it applies to this current situation or not. Therefore, the best answer is C. Do not resuscitate the patient in accordance with the DNR/DNI. A is incorrect because the patient has a clearly expressed DNR/DNI order that was updated at the time of admission. It has to be assumed that this order is a valid expression of the patient's wishes and should not be overruled. B is incorrect because there is no need to go down the line of surrogate decision makers in this case. Even the patient's spouse may not contradict the patient's clearly expressed directive, and so consulting other family members would not be appropriate. Finally, D is incorrect for the same reasons stated in the last question. Remember, rarely consult a hospital ethics committee in these questions. So again, the correct answer is C, and that should be everything you need to know about decision-making capacity.